In our mythology religion, পঞ্চপিতা সপ্তমাতা। পঞ্চপিতার মধ্যে your original father-in-law is also father, and Guru also is also father. So you have to. So I will place my life in service of others. আমি আমার জীবনটাকে I will give my life in service of the people. So why the medical profession is so noble? So noble means because you are dedicating your service, your life, whole life, in the service of others, yours. I will place my patient interest before my own. Think that you have got some own interest also. Patient interest will first. As for example, there are many doctors or businessmen. So like a fisherman, he will sell fish. So it may be rotten, it may not be rotten. So he will try to give you the rotten fish all and day. Many of the people are businessmen are like that. Sometimes one company comes to write a medicine to you, thinking that, sir, you write my medicine, I will give you some gift. But you know that medicine is not so much good. The company is not also good. You are writing because of your own interest, but you are getting some benefit. So that is illegal. So your moral principle is break down there. So try to become good man yesterday told. So this is called I will place my patient interest before my own. My interest, I lose my interest. I will give more importance to the patient. I will protect my patient from harm and injuries. You have got no right to do harm. If you cannot give benefit to your patient, if you cannot help your patient, sometimes you think you may have like idea that you do not know the disease or you cannot diagnose a disease. You have no idea about the disease. You refer him or her to a better person. He may be better person means maybe he your friend also, no problem. You are not supposed to know all these things. I am not supposed to know all the things in the world. So I am concentrated with my own subject. But if a patient comes to, I am an orthopedic surgeon. So if a patient or orthopedic surgeon comes with some general disease, like medical disease, hypertension, I am not well expertised with medical diseases. So I must refer the case to my physician friend. So to get better advice, I may write some drug. I know antihypertensive drug. You know antihypertensive drug. You are a gynecologist. You know. You write initially, but you tell her or him that you please visit a physician for better advice. Do you follow? You don't try to write all the things. So I will treat all patients equally. Means a patient is relative, your friend. So another patient is not your friend, unrelative. So you should give equal importance to both. All patients are my parents, all patients are my brothers, all patients are my sisters. So you take everybody equally. So I will respect my patient's right to make decisions. As for example, you have told that you have got gallbladder stone, so you have to go undergo some surgery. So gallbladder stone surgery is needed. So there are two types of gallbladder surgery. One is open surgery, one is laparoscopic surgery. So you explain that it may be operated by open pathway, we will give an incision, operate, or you may do. So let her take decision. And you have to inform the hazards of both the things. Pros and cons, benefits and hazards of both the type of operation. So after that, she will take up decision. Sir, I will take this laparoscopic operation, or I will take open surgery. There are benefits of both, or harm of both. So later, you cannot impose. A patient comes to you, trochanteric fracture. Trochanteric fracture may be treated conservatively or operatively. You have told them that you treated conservatively. Nowadays, the choice is operative. So she will tell, no, I will not operate. You cannot force that. Even her son or daughter also cannot force him or her for operation. Nobody. So a patient, if she is adult, if she is not or he is not mentally sick, he have got right to take decisions. I will continue to improve the care I have given. So there are plenty of for trochanteric fracture of the hip. Trochanter is area of the hip bone, femur. So if there is a fracture, the operation earlier 10 years back, what was done, now it is changing. So you have to improvise your knowledge. It is a technical thing, engineering and medical science. Science is progressing. Every time we have to go to conference, we have to read journals. New things are coming up. We have to be updated in our knowledge. So we have to take care, and care we have given earlier. Whatever I have done in my student life, now I am not doing. And 5 years, 10 years back, what I have done, I am not doing now. New things I am adopting. So I try to improve it. I will not become intimate to any patient. So sometimes you have got some boys might have some inclination to girls. Girls, lady doctor has gone. So you should not be any inclination to anybody. Many times we have seen some doctors have got these things. In some instances, some intimacy to one patient, that is not good. So that impartial to everybody. All patients are mine, like God. They are my relative. They are not my relative. But all is equally treated. So they are not. I don't think that they are my own, my lover or like that. Never think like that. So let her come and take treatment equally. No relationship personally. I will try to prevent as well as cure disease. So, any doctor has got two things to do. One is called preventive part, one is called curative part. Curative part means you have to give treatment you have to diagnose the disease clinically, you have to do investigation, confirm your diagnosis by investigations, blood investigations, X-ray, CT scan, MRI, whatever is needed. So, confirm the diagnosis and cure. This curative. And you have give some advice for prevention of disease. Why it has occurred? You should avoid it if you do these measures, preventive measures. So I will protect my patient's confidence. And second, the last thing is one thing, patient will confide you many things. They will tell you many things. You should not leak it to others. You should not speak it to your family. Whenever you are in chamber, you are in hospital, you hear many things. You never discuss it with anybody. Your friend, that this patient has come with these problems, some other physical problems, mental problems, or familiar problems, they will confide you everything. But you should not dig it to others. I will impart my medical knowledge to others. So, whatever. Sometimes you might be knowing better than anybody as far as one topic, and you should tell it to your colleagues that this is come at modern treatment. You should learn it. You should do it. You don't keep everything in yourself. So বলে না ওরে বললে ও শিখে যাবে আমার থেকে বেশি জেনে যাবে. This is not fair. So impart your knowledge. Knowledge যত দেবে তত বাড়বে. নলেজ যত দেবে তত ভালোবাসা দিলে ভালোবাসা পাওয়া যায় সেরকম নলেজও দিলে নলেজ বাড়ে and you repeat your knowledge. For example, একটা টপিক তুমি পড়লে, if you discuss with your one friend, you will remember something, and another friend, every time you are discussing, it will be hammering in your brain and you will remember it. Yes. So this is the Hippocratic oath. You are our god of a father of medicine. So he has given some principle and ethics for us, and very sacred thing we must follow in our life. Next we will come to my topic. Principles of primary health care and general and community-based care. So, last slide. Do you know who is a doctor? If it is told, define a doctor. বলো তুমি বলো কি নাম তোমার হ্যাঁ ভালো না বলো বুঝলো তুমি বলতে বললে ইউ আর গোইং টু বি ডক্টর আমার লেকচার কিন্তু একটু একটা এদিক ওদিক যায় ঠিক আছে আমি বলতে আরম্ভ করলে ইভেন আই স্টার্ট ফ্রম পরিষদ আই অলওয়েজ ট্রাই টু রিড নট অনলি বুকস when I was a house surgeon just after passing MBBS, I went for an interview at Postgraduate Hospital of Kolkata in the year 1981, 82. So, the professor in the interview asked me, what you have read? Then I told many books of my own, like textbook of this, textbook of that. He told, any other books you have read, novels, Sharat Chandra in Bengali, Bangim Chandra, at the time I was not so much voracious reader. History. Have you written the history of modern India or medieval India or the writings of Jawaharlal Nehru, Vivekananda? So, Upanishad, Mahabharata, Ramayana. So, we must read all the books. So, all-round development will occur only by this. So, a doctor is a person who helps to get the patient relief of their pain and saving lives. So, he helps to relieve pain and save life. He will diagnose the disease, he will treat the disease, and he will advise for prevention of the disease. What are the responsibilities of the doctor? The doctor's responsibility is examination of a patient, diagnosis of illness clinically, confirming it with some investigations, modern investigations, and he will give medical treatment. And comprehensive medical care. Comprehensive means giving him complete cure in all the physical, mental, and also psychological. All the way of physical problems, mental problems, psychological problems, social and ideological or adhyatmic jat unnoti hai, everything you have to give. Healthcare education also you have to give. Healthcare education means why the disease is occurring, how we can prevent it, what are the foods. Many times people will ask you, sir, I've got this disease, what food I can take? Like a patient of kidney disease or liver disease will come. They will ask, can I take rice? Should I take roti? Or should I take fish or meat or chicken? They will ask, salt, how much I can take? What foods I can take? So you have to know, there are some foods where calcium is more. There are some vegetables where potassium is more. Fruits, potassium is more. So potassium more can be taken, the more potassium related foods can be taken by the patients of low potassium level. Potassium is a very good mineral for our heart function. So increased potassium causes also heart problem, decreased potassium. So potassium rich food are banana, orange, these are potassium rich food. So like the calcium rich food, you must know milk and meat product are the highest calcium resources. Then maintain the record. So you have to maintain the medical records. Sometimes you have to go to court. The patient may come with some road traffic accident. So, or some other injuries, violence, they have some injuries. So you have to maintain records because you have to give records for two reasons. Number one, you have to attend the court. number one, attend the court. Court will ask you, you give the injury report. What are the injuries? And how the injury occurred? What is the age of the injury? So you have to go to it. All doctors go to. All doctors after passing, whenever you are doing emergency duty or in hospital duty, you have to give injury report to see the patient. So this is one. Second is, you have given some medicine to some doctor, to some patient. So after some time, he might have some reaction to the patient. You have not maintained the record. He will file a case against you, compensation case in the court. 2 lakhs, 5 lakhs, 1 crore. It happened to a doctor in court who was a professor. One patient died. His wife was a doctor. Wife is also a doctor. He is staying in USA and wife came to India. Wife is a doctor and she has got some skin problems. She went to a professor of medicine, skin. So professor of skin was her teacher. So he gave some medicine. There was some reaction. So she went to a physician again, and the physician was very renowned in India, He was the teacher of many professors in Tripura, not only Tripura, in India. So their reaction was not subsided and it was increased. She went to Bombay, she died. The doctor filed a case of 1 crore and with application to the court why the teachers, that professors, registration will not be cancelled. So registration was cancelled. All the doctors, three professors are punished by the students, by his student body. But it was not intentional. So hazard may occur, but later on court has taken decision because many doctors went in favor of this and applied that professor was a teacher of many big doctors. So it is an example I am telling you. So we must be very meticulous in writing drugs. So one thing we have to understand, if you cannot help a patient, you have got no right to do any harm. Do not do any harm to a patient. So let us come to our principles of primary health care, our topic today. Next slide. So the contents are introduction to healthcare, evolution of primary healthcare, the Alma Ata Declaration. The Alma Ata Declaration, Almaty is a place in Kazakhstan. It is the biggest city in Kazakhstan, and there was one conference of all of the world doctors to make declaration how the health system should run. So that was taken to action in different countries as the Alma Ata Declaration. Attributes of primary health care, components of primary health care, principles of primary health. These are the topics I will cover. So evolution of primary health care in India, primary health care scenario in India, brother, 30 years after Alma Ata. So Alma Ata was taken 30 years back. So conclusion and reference. Health is a fundamental right. So everybody, any patient will come and you have to cure the patient, you have to treat the patient, and it is his fundamental right to take treatment and cure from the doctors. Maybe in the government sector, maybe in the private sector, whatever it goes, it is his fundamental right. And integrated care comprising preventive, promotive, curative, and rehabilitative service. So you have to give, this is called integrated service, not comprehensive. Integrated means comprehensive. So you have to give some advice why it should not occur. Promotion of the health care, curative also. Curative means you give some maximum diagnosis and give some medicines like that. And rehabilitation service. As per rehabilitation means, as per example, a person has a stroke, cerebrovascular accident, one-sided paralysis. So you have to give paralysis, some rehabilitation, exercise, or orthopedic patients, stiffness of the joints, or a patient may not have any limb, amputation of one limb. So you have to give some rehabilitation service. So what are the like artificial limb you have to give? Then prosthesis you have to give, below knee prosthesis, above knee prosthesis you have to give. So extending from womb to tomb, you have to give care from pregnancy. Womb means pregnancy. Some pregnant women we have to treat before birth. To tomb means up to death. So a patient fundamental right, and you have to give a comprehensive health care, extending from the womb to tomb, and key to socio-economic development progress of the country and socio-economic development of the country or progress of the country is evaluated by the healthcare system. Because a country is evaluated by maternal mortality rate and infant mortality rate. A developed country with less infant mortality, under 5 mortality, and infant means below 1 year, below under 5 mortality rate, and also maternal mortality rate, and socio-economic development. So if you are more socio-economic developed countries like USA, our country is a developing country. So many people are not socio-economically backward. They will not get better treatment because they cannot afford for purchasing the higher cost medicine, number one. Number two, they cannot go to that places where most modern industries are done. They are very costly. Many of our hospitals, government hospitals, what medicine they are doing, not costly. MRI is very costly. In government hospital, though it is less in some states, but in many places it is very costly. So many people who are economically deprived or under economic condition, so remember, they cannot afford. And these are organized in 3 levels. So level, these all healthcare is given primary level, secondary level, tertiary level. So I will explain primary level, secondary level, 3 levels. This is like a pyramid. Alma-Ata Conference is there in 1978, conducted from 6 to 12 September 1968, International Conference of Primary Health Care, and key to the attainment goal of health for all. Health for all means persons from womb to tomb for the backward classes as well as for rich classes. Health is a fundamental right for all people, all sectors, poor and rich. So this conference was in Kazakhstan and they have taken decision there. So health should be for all. To promote the concept of primary health care, Alma-Ata, this is the objective. Promote the concept of primary health care, evaluate the present health care situation. Presently, क्या है? They define the principles of primary health care, define the goals of governmental, national and international organizations. So, governmental means our government, national means some NGOs, international NGOs also helping. So many NGOs are also formulate the recommendation for development. There should be some formulation for development. So, declaration of the Alma-Ata, there was some existing gross inequality in the health status of the people is unacceptable. So, inequality in the health status of people. In some states or in some sectors of the or parts of the country, some people living below the poverty line, their health status is poor. So, it is unacceptable. So, health status should be good in irrespective of their economic status. People have a right and duty in participating individually and collectively. They have to participate alone or collectively, family or neighbors and society, all people. Primary health care is essential health care. An acceptable level of health for all by people of by 2000. It was by 2000 It was now 2024. So we are ahead by 24 years. But we cannot tell that comprehensive healthcare is given to all sectors of people in our country till now. So primary healthcare is essential healthcare made a universal definition. What is the primary healthcare? Essential healthcare made universally acceptable and to them through their full participation at the cost the community and country can afford. So you see essential healthcare, universally accessible, full participation. It should be acceptable and it should be fully participated by the community. Means one community, one country, all the communities can, but Bengali in India or tribal community, Bengali community, Muslim community, Hindu community, everybody will accept it and afford to maintain every stage of their development in the spirit of self-reliance and self-determination. So this you will read in preventive medicine in second year, third year will go. So primary health care, what is primary health care and definition they will ask you. So attributes of the attributes of primary health care, essential health care, what are its part? It should be essential, universally accessible, universally accessible and acceptable. Accessible means everybody should go there and take access. Area. Once you see, there is some PSCs, primary health center, which is 10 kilometers away from, it is for my house, my house is here, so there is a health care here, primary health center, but it may be very distant from another person's house. So it may not be accessible. There are some accessible means distance is very much. That's for example, there are some GB hospital. GB hospital is not accessible here, from here. It is a long distance from GB hospital, 10 kilometers, 15 kilometers. So accessible, this one, and acceptable. Acceptable means you must accept the treatment. This treatment I may not accept it. So acceptable and acceptable. Community based. Whole community based means it should be taken up by the community of the persons. A few persons, and community is made of few families and or a big community like tribal community, Hindu community, Muslim community, like that community, one community will be there. First point of contact and affordability. Affordability. It should be affordable by everybody, acceptable, universally accessible. Attributes again, adaptability, appropriateness, it should be appropriate, community participation, it should be continuous. They ask a PSC there today, tomorrow it is stopped. बंद हो गया, डॉक्टर नहीं है, सिस्टर नहीं है, कम्युनिटी बंद हो गई, ऐसा नहीं है. So it should be continuous treatment. Continuously somebody should be available to give curative as well as a preventive treatment. Comprehensive means giving all sorts of health care, preventive, promotive and curative. And there should be coordination among the different departments. Without coordination, we cannot. So patient and you see that is the continuous, accessible, accountable. So this is the house, everything is there. So it should be like that. Should be accessible, it should be continuous, comprehensive, patient and family centered, like that. So that is same thing we have told. It should be appropriate, acceptable, affordable, accessible primary health care. The education components of primary health care. Education concerning the prevailing health problems. So you have to tell the patient what are the problems in the health problem. In their every area may have different health problems. In some area, diarrhea may be a common disease. In some area, you go malnutrition is suffering. Malnutrition. If you go to different areas in West Bengal, the health, prevailing health problem in West Bengal is different from the Bihar. Or in some area, in Bihar also, in some area problem is one thing, another area same. Another thing. Method promotion of food supply and proper nutrition. Many of the people undernutrition is also a factor for many diseases. Malnutrition diseases, kwashiorkor, marasmus. Not only that, if the nutrition is poor, patient will have less body resistance, and there will be calcium deficiency, iron deficiency anemia, very common iron deficiency anemia, and we are giving iron tablets also. So these are the adequate supply of safe water, a basic sanitation. You see, many of the remote areas, we are not able to supply safe water. Safe drinking water, we have to supply. Because water is very essential thing, and many waterborne diseases occur due to non supply of safe water. So waterborne diseases like gastrointestinal disease, cholera, even typhoid also is waterborne disease, jaundice is also waterborne disease. So many diseases, viral infection occurs, bacterial infection occurs, waterborne disease is very dangerous. Maternal and child health care, including family planning. So maternal problems in pregnancy, there may be anemia. So that is the child care, child vaccination is a very important thing for child, and nutritional problems in child, and also many childbirth may lead to the maternal health loss, as well as the economic loss. So a family having 6 children, 8 children, so they cannot maintain their families due to economic burden, also cannot give them food. In our time, so our parents had so many children. Nowadays, we have adopted, so that is a very important thing. Family planning is also important. There was previously two children norm. Then many people are taking one child norm. If you go to many other countries, negative growth, like Italy, negative Sweden, negative growth, no child, Japan. So components of continued from that side. So immunization against major infectious diseases. So we are giving immunization from the birth. We are giving polio. Polio vaccine is very common. Oral polio vaccine. Dhanushtonga tetanus vaccine. So malaria vaccine is underway, going on. BCG vaccine for tuberculosis. So these are the major giving pneumonia vaccine. Nowadays many other vaccine, and for that reason, you have got another class 1 benefit, universal precaution and vaccination by Professor Pediatrics. Prevention and control of locally endemic disease. This part, I am orthopedic doctor, professor. This part is not mine. But still I am speaking because I have to read. You have to read. Sometimes it may happen that this is not your topic. You are told that you have to give lecture on this. This is not my topic. I am a gynecologist. I cannot. Well, no, you have to read. Let us read. Let us see. So never go away from your task, whatever is given to you. Appropriate treatment of common and diseases and injuries. So common disease, fever, diarrhea. Very common people come. Kumar betha, backache. People will come. These are very common diseases. So you must know how to treat this small disease. Running nose. Nowadays, in every house you go, there will be running nose. But I do not know what drug you have to take. There is backache. I do not know what is backache. It was not told me, and my teacher did not teach it. I did it in 3rd year. So it is not like that. So basic things after passing MBBS, basic things you have to know. Common disease and injuries. Injuries means it may be a closed injury, it may be open injury. Open means cut injury. So you have to know how to give a stitch. So whenever you will be posted in internally or even finally also you can take your interest in giving giving some stitches. So repairing of the wounds. Or it goes into like fracture, upon fracture, how to treat a open fracture, closed fracture. So dressing of the wounds. You have to learn it, gradually you will learn. So one thing in our time, many mass brain is not needed in medical science. There is no less mathematics. Some mathematics should be there, but it is not like engineering, they are all mathematics. So those who are afraid of mathematics, like me, they will come to medicine, medical science. So they will succeed only by study. And you cannot remember everything. There is huge subject. Then how to remember? For me, in my experience, I was one of the best graduates in my time. Many medals I got. I was a student from Calcutta University, West Bengal University. At that time, no Tripura University, Tripura board also not there. So, you read every day, 4 or 5 hours. Even in no other way. This is a good place, very good place for study. And so, our medical college is from Odisha, my medical college. It was also like this. Nothing is there, no friend, nothing. Only friends are there, only friends, hostel friends. No cinema hall nearby, nothing. So we used to read from 6:30 to night 1:30, 2:30, like that. 2 age average. In the meantime, there was mess in the canteen. We have to go to canteen. Food taken at 10 o'clock. It is again study. So read. So 6 days, 5 days you read. Last day you repeat. Do you follow? You forget. Monday, whatever you have read, Saturday you have forgotten. Because every day new things will come, new things come. So, yeah, that day, that time, we should tell my parents that I am forgetting and learning every day. Learning every day and forgetting every day. So, at that time, no telephone. Only writing letters to the parents, only in envelope. Letter. So, you have to read. My motto, on Saturday and Sunday, repeat reading. Old things, Monday, Tuesday, whatever you have read, by 2 days you read. In my opinion, I'm not telling you may take it, may not take it. To become a knowledgeable person, you have to read. Somebody is very rapid reader. Somebody is not. How to increase the speed of reading? In the childhood, when we are small, we used to read like this: A, P, P, E, M, P, P, L, E, apple, by spelling every word. Then time came, apple. Here, now I can read a line at a time, a line. Swami Vivekananda used to read a whole page at a time. Whole page like this. So one day, when he was out of the topic, sometimes I go out. One day he was in the library. And another state, I forgotten, is your king, he went there. And every day, assistant of the king go to a library and bring books. And next day, Vivekananda was staying there and he used to read the book. And next day, he used to return. And one day, that librarian told, what is there? First day you are taking the book, so huge book. Next day you are returning. What you are playing with the books? But no, we have got a saint. He is reading the books. Reading? By one night, so many books. How can he read? Then that fellow came. Well, I want to see him. Then he came to see him. Then he asked, you have read the book fully? Yes. Well, you ask any question from any page. Any page. So he asked many questions in different books. He answered. So Then he told, what is it called? This is the concentration of mind. Concentration of mind. So another incident happened. He was in USA and over a bridge. A bridge was one of the river, over a bridge, and he was supposed to cross the bridge. We have seen eggshell, dimer khosha. You understand Bengali? Everybody, dimer khosha. Eggshell was floating in the river, and the boys was targeting with gun type and targeting to hit it in the river. And Vivekananda staying there. He went for Chicago lecture. Then he saw that nobody can hit him. Then he took the gun from them. Then he told you, see, he fired and hit Abhi. Then that boy asked, Are, you are a gunman. You are doing money. He thought that he is a shooter. He is doing like that. He told, no, this is the first time I shoot it and everything. Then told, how? This is concentration of mind. He told that this is my concentration. If you concentrate deeply, you can do it. Like Arjun, you know, Arjun, তীর মেরেছিল জল দেখে. So concentration. So concentration of mind, if you have, you can go through anything. Only 5 years. Only 5 years. So 5 years you read. Next 2 to 3 years again you can read for higher. Otherwise, and whole life you enjoy. You enjoy. Yeah. तकलीफ करना है only 5 years. तकलीफ नहीं है. Study में there is no difficulty. परिश्रम तो नहीं. बसे बसे पढ़ा. But when you put practical life, very tough. Very tough. So let us come to again our topic. Immunization as a method of illness, prevention and control of locally endemic disease. Endemic means there are many things. Epidemic, endemic, and sporadic. Sporadic means there are 3 terms. Sporadic means kotha hoy. Somewhere this place, some diarrhea case. Again another village 3 cases, another village 2 cases. Or endemic means in this village 15, 100 cases. This is one endemic. And then for the epidemic. Epidemic means a big country is epidemic. Epidemic of disease diarrhea in India, like that. Or in Assam, epidemic in Assam, big state. Hundreds, thousands of people, lakhs of people are affected, epidemic. Because sporadic, endemic, and epidemic. So, appropriate treatment of common diseases and disease, provision of essential drugs. There are some drugs government has declared these are essential drugs. Some drugs may not be essential, so some drugs are very essential. Essential drugs means those who are very much essential. Paracetamol is essential drug. Paracetamol, very crucial drug. Proton pump like pantoprazole we take, gas tablet, very essential. Toxoid. Toxoid, vaccine. It is vaccine. Like that, decadron, very allergic, anti-allergic tablet, and cetirizine, like that. So, but some drugs are very essential. So, equitable distribution, community participation, and intersectoral coordination, appropriate technology. So, equitable means equally distributed. Equitable is a word, legal word, equitable distribution, equitable. Just for example, there is a example is equitable like there is a divorce case, husband-wife divorce. So after marriage, there is some property. So the property would be divided between after divorce. There will be divided among the husband and wife. That decision will be taken. How much percentage she will get or he will get, that will be taken decision by the court. Some legal. So there is equitable distribution. Equitable distribution of legal distribution of everything in our health sector also. Like equitable distribution means how much we will give provide service to the this area, and how much we will give to Agartala area, how much to this area. So this is the equivalent. And community participation. Community participation, full community should participate in any health program. As for example, we are giving some vaccination. So in this area, so one community would participate, another community would not participate. That is not. So all communities should participate in some of the health principles taken, health steps taken. Intersectorial coordination in between two sectors, like health sector is that safe drinking water, PWD, water supply. So there should be coordination between the PWD, safe drinking water supplies, the department, agriculture department, agriculture to give good food supply, ration shop, rationing authority. If this area is very poor, ration shop is not there, nutrition drugs cannot be there. So we have to support them by giving rice, dal, or some products, food products for the day. So different sectors, agriculture sector and health sector, PWD sector, safe drinking water supply sector should be coordinated. And appropriate technology should be given. And appropriate technology, modern technology, whatever is given for investigation purpose and for the screening purpose. Investigation means modern technology means if in this area a hospital does not have many government hospitals is not equipped so much. Private hospital like Apollo or Medica, whatever hospital are well equipped. So all patients, maximum patients, even poor also, they have got always thinking that we must go to that hospital. We will to go to Hello. We will go to, because all machines are available. You cannot treat the patient with your machine. MRI, modern technology, CT scan, X-ray. You write, you have seen that the patient has got injury. You have, oh, there may be a fracture, there may not be a fracture. You have to do an X-ray. So that is not. So how to confirm? So a doctor, when you are posted in your time dispensary or PSC, so you have to refer him or her to a better place. And they will think, these doctors are not doing. That is not your fault. That is not supplying the. So if you work in a better place, you have good. So this technology should reach to the lower level also, to the village level also. But we cannot go there, we cannot supply these things because of some, I will tell you, problem, economic problem of the government. Health sector, that is a separate lecture. Inequity in the ability of the health services major concern. Inequity of the ability of health services major concern. Equal distribution of the or it is not available everywhere. Supply of healthcare resources more towards affluent areas. Healthcare resources means what are the healthcare resources? Doctors and sisters. So they got more towards the affluent areas. Means বড় লোকদের এরিয়াতে বেশি বাবা আগরতলা দেশিয়া তো এখানে রামনগরের লোক যাবে জয়নগরের লোক যাবে ওইখানকার লোক তো যেতে পারো না তো হসপিটালগুলো যদি give a hospital like here one Apollo hospital comes up they cannot afford also so they've got less money poor person and also so all big hospitals কোথায় আছে কলকাতা আছে দিল্লি আছে বোম্বে আছে affluent area so there is less manpower or resource, good resource, big doctors, all professors. Kothay professor? They should calm down also over here. Julian Tudor Hart, inverse care law, availability of good medical care tends to vary inversely with the need for it in population served. You follow availability of good medical care tends to vary inversely with the need for it in the population served. So whatever population served, major population is poor. So good medical trend, priorities to be given. It is not there. It is there in the inverse support. So it is the inverse care law. So those people are economically solvent. They are only we are giving the good medical care. But under poverty level or economically deprived level, they are not getting much. He said, Senate said, কেন ভর্তি করে আসতে বলো So first key principle কতক্ষণ স্লাইড কটা আসবে আরো প্রচুর আছে So first key principle in the primary health care equitable distribution first key principle in the primary health care ensure that individuals with more compromised health conditions will receive more health services বুঝলেন যেটা বলছি আগে বললাম না একটা কে কতটুকু পাবে শেয়ার দ্যাট ডিপেন্ডস অন নিড মিন্স যে দরিদ্র সে বেশি পাবে কম্প্রোমাইজ হেলথ কেয়ার মানে যে রোগীটা বেশি সিরিয়াস তাকে যত্ন না করে যে কম সিরিয়াস বড় লোক তাদের দিকে নজর না দিয়ে যে বেশি সিরিয়াস গরিব তার দিকে নজর দিয়ে সো কম্প্রোমাইজ হেলথ কেয়ার উইল গেট হাসপাতাল রোগী ভর্তি হলো ইফ এ পেশেন্ট আয় সবাই আয় হাসপাতাল রোগী ভর্তি হলো ভেরি সিরিয়াস কিডনি ফেলিউর লিভার ফেলিউর মাল্টি অর্গান ফেলিউর তুই গেলি দেখে বললি ও কিছু না এটা তো বলে যাবে বেশি কিছু করার দরকার নেই নেক্সট পেশেন্ট উইলছে সো ইউ গিভ মোর কেয়ার টু দ্যাট পেশেন্ট you see 10 minutes you give less to another one so give more care to the compromised health care and commitment to health equity focuses not only on ensuring program inputs but also reducing difference in health outcomes commitment to health equity focuses not only on ensuring program inputs তুমি প্রোগ্রামটা দিলি কিন্তু প্রোগ্রামটা দিলে সাকসেসফুল কিনা কতদূর হেলথ ডিফারেন্স হলো you have to measure the two outcome টা কতটুকু আসলো you have to measure the two also so once you are giving iron deficiency anemia example so you are distributing iron it is given in the program iron anemia preventive program tuberculosis control program national program these are national program malaria control program so these are the control program so you give the input not only input you are giving iron but you have to measure 100 লোককে আয়রন দিলাম 3 মাস পরে আবার খাওয়ার পরে I have to see out what is the outcome আমি দিলাম কতটুকু উন্নতি you have to see the input of the outcome equitable distribution is horizontal equity ওই দেখো they are given equitable distribution on one diagram So horizontal equity and vertical equity. Horizontal equity equal access for equal needs. Equal needs, equal access. মানে তোমাকে যে নিডটা লাগবে এটা everybody should have equal access. সেটা বড় লোক হোক গরিব লোক হোক equal resources. Resource means doctors, sisters, healthcare providers. These are equal. Equal access to healthcare. This is, you can tell somewhere is Marxism and সবাই সমান দিতে হবে Kazakhstan was a part in Russia at that time so all are given not for poor rich people everybody will be equal everything will be equal so equal utilization of health services equal health so everything should be equal you see equal resource equal access equal utilization equal wealth means equal resource to equal access means a hospital টা হবে এমন জায়গায় একটা হসপিটাল হবে যেটি equal access for everyone এখান থেকে 2 কিলোমিটার এখান থেকে 2 কিলোমিটার এখান থেকে এখন একটা হসপিটাল গুলো গ্রামের একদম বড় লোকদের জায়গায় বসে একদম শহরের মাঝখানে সেখানে খালি ওই এরিয়ার লোকগুলোই দেখবে বা আরগুলো হচ্ছে 10 কিলোমিটার দূরে তাহলে equal access করুন so equal utilization of health services so that everybody should get the health services equally. All sectors of people, poor, rich, irrespective of religion, caste, and that equal health. Everybody should get equal health benefits. And vertical equity, unequal should be treated in proportion of their inequality. Vertical means a patient not getting proper unequal, he is not getting treatment, long distance, or economically poor, or uneducated, they are not getting. So they should get in proportion of their inequality. মানে তারা কতটুকু কম পাচ্ছে, you have to see কি কারণে কম পাচ্ছে, due to lack of education, lack of poverty, or lack of distance, long distance. So we have to measure this thing and we have to take care of it. So this individual with more need should have more treatment. More need, more treatment. Good morning, Bashar. So individuals with more need should have more treatment. Yes, sir. The central theme of need, therefore, determines the equity. So need-based treatment. Need-based treatment means the person who has got more difficulties, more need, they will get more treatment. It is not that you are rich, you will get more treatment. Accept aspects of equity of health and healthcare, equity in access to healthcare, equity in health and effective coverage. Examples is equal to access to healthcare in India. Helicopter service to reach more remote set of tribal health. So where there are some places where there is no service, bus service, train service is not there. So nothing is there, patient is very severe. Sometimes we have to give helicopter service. যেমন Andhra Pradesh, bus passes to pregnant women for the antenatal visits. They go to home and they give antenatal. And Assam also like that. There in Assam, there are big lakes or there is river. So there is even an island. Through the island with the river, Assam একটা দ্বীপ আছে, river দ্বীপ. So তামিলনাড়ু একটা, সুতরাং যে জায়গাতে যেরকম আছে, everywhere you have to give service according to the need of the area, so that remote places can also be connected, and places when the remote place and the people are more needs help, they also get the service. And socio-economic inequalities are widening than narrowing. Failure of publicly financed health care to reach the poor people. So many times when we tell that advertisement is there, so many poor people in remote area or uneducated people, they do not know these things, what facilities are available. So they should have publicly financed health care. The poor people should also get this benefit of it. Too little knowledge about the relative importance of inequalities in the determinants of the health and health service utilization. Too little is known about the impact of programs and policies on the health. So many people, even we are educated or uneducated, remote place or who do not know the impact of programs, health programs, different programs, tuberculosis control program, national program. So and also different policies of the health sector inequality. So they should know all the. We should have some facilities to give them health education. So eradicate active poverty and hunger, achieve universal primary education, promote gender equality and empower women, reduce child mortality. These are also very important. Eradicate active poverty. Our national income, as for example, our national income is 5,000 rupees per year or 10,000 rupees per year. That is the income of my income, your income, or poor income. Everything is 3% income, everything average. You and divided by 3, 4 or 10. Ambani's income and my income divided by 2. So this is the national. So this is not the eradicate active poverty. So a poor person also getting 10,000 rupees per month or he has no income at all. But because his national income is calculated like that, with the biggest industrialist, all industrialists plus all population divided by population. 140 crore population और ऊपर में जितना है income पूरा divide. Everybody, Ishapular, he gets daily 100 rupees also, but he is now 10,000. Not like that. So, extreme poverty and hunger you have to eradicate by knowing the facts that his income is very less. We must give him some facility or for income. Achieve universal primary education. So, education is very important. Education and also communication. If you have got no communication facility coming to Santiniketan, then how can you come? There are many places in remote area, communication is not there. In hilly areas, we cannot reach. Helicopter service is there, or we have to reach on foot for 10 hours from town or from area, PSC area, we have to go on walking in the hilly areas. So, these areas and achieve primary education, school is not there. We must have, and many schools are there, teachers is not there. And teachers are there, table chair is not there. So, building is not there. So, everything, school education is very important. Many times due to poverty, students are reading in class 2, 3, coming out from the school, going to level. School shoot. School, they are not reading because they need income. So, we have to have primary education also should be a basic right for this. Promote gender inequality and empowerment. Many times women child in many states. It is seen earlier days they have to say বাচ্চা হলো whenever they will become a lady child, বাচ্চা মেয়ে বাচ্চা হলে বলে কি girl but they will not take care of it. So, gender inequality should not be there and empower women. And it is told that when you should give some power to women. In fact, women are getting nowadays power. In fact, when women are educated, a mother is educated, a whole family is educated. It is told like that, mother is educated, whole family is educated. If the maternal health is not good, the child health will not good. So, she should be well nutrition, should be given power, economic power, service. Nowadays, all girls are coming up. So, that is very important. And reduce child mortality. Child mortality is the index of development of a country. So, child mortality, the countries where child mortality is less, that is more developed. Improve maternal health. Combat HIV, AIDS, malaria and other diseases. You see HIV and AIDS are, HIV/AIDS, they are same, and malaria and other diseases. Tripura is the endemic area for malaria. West Bengal, many states, Assam also. So, malaria eradication program, and nowadays it is reduced, but a time was there, whenever a fever case used to come in our PSC, when we are young doctors, we have to give that is called quinine injection. Quinine injection was available, in saline also we have to give quinine, and also chloroquine tablet we have to give. Chloroquine and primacin. We used to treat. Malaria was very much endemic. Nowadays, due to some steps taken by government, it is reduced. And HIV nowadays very much endemic in Agartala. And also many people are taking injectable injections. So by taking these injections, that is called nasal injection. So these are very bad things, and they are getting this injection. And also drugs injection causing AIDS. Because they are same series, everybody is sharing. So that is ensure environmental sustainability and develop a global partnership for development. If one nation cannot go by itself, and we are not self-sufficient in all things. So global partnership for all. I have got this deficit, I will take some help from them, others. So neighbors, but other states, they also take some help from us. So give and take, and global partnership is necessary. So community participation, community involvement of the individuals, families and community determines both collective needs and priorities. Important role in formulating a health problem, make informed choices, objectives and community priorities. Universal coverage cannot be achieved without the involvement of the local community. So, any health program, whenever it is implemented in our society, if the whole community is not involved, is not educated, they will not come, they will not be in. So, educate the community and total involvement of the community, positive effect. যে আপনারা সব টিকা নেবেন, আপনারা সব ভালো মন্দ খাবেন, বাই আপনারা মশারি টাঙিয়ে ঘুমাবেন, you have whole community, you have to give education, health education, and involvement of the whole community. In some community, they are dominated by their Sardar. They have got Sardar in disrespect tribal communities, like the old age. So in that community, you call the Sardar, have a meeting or all that, and speak them about the benefits of the things. Benefit. And also you have to tell the doubts, you have to clear their doubts. So barefoot doctors. So once barefoot doctor course was there, started in our India also, but it was because of many educated doctors, MBBS doctors, refused to go to rural areas. Rural areas, the facility for doctors was not so much available, communication was not good, and the community, they cannot mix with the community, staying facility, waters, থাকার facility, schooling, friends, they are not available. So many educated doctors are not available in our remote places. So government thought of giving barefoot doctor 3 years course. They have to train some doctors and students up to 12 or even up to 10, 8 part, 9 part also. Basic treatment, for fever, for malaria, for the diarrhea. What are the basic treatment? Barefoot. In China, lack of ability of rural health services was addressed from 1965 to 80 by development of barefoot doctors. So it was also referred in India. So, but nowadays we doctors protested for that. Rural farm workers were given basic health training. Farm workers, চাষারদের দেওয়া হতো, given basic health training to provide combination of traditional and Western medicine. Traditional medicine যেরকম দেখবি অনেক সময় if there is a spray, the হলুদ আর এই দিয়ে পাতা বেঁধে রাখে, বা অনেক সময় দেখবি এটা এই পাতা দিয়ে কাটে গেল, পাতা দিয়ে চেপে বেঁধে রাখে, গাঁদা ফুলের পাতা দিয়ে চেপে বেঁধে রাখতো, ট্রেডিশনাল মেডিসিন। হ্যাঁ, and Western medicine, toxin injection, আমাদের যে মেডিসিন গুলো আছে, antibiotics, dressing. So both the training were given. Traditional medicine also given one time. Regarding অনেকে দেখবি যে কেটে গেল, রক্ত বন্ধ হয়ে যায় না, বরফে লাগিয়ে দিচ্ছে, রক্তটা বন্ধ হয়ে গেল। Is that tradition? যেগুলো চলছে regarded as model for development of community health workers. So barefoot doctors is not nowadays here. So one time, nowadays the doctors facility, doctors are going in a way also, because we have developed our communication, health facilities, and also pressurized from the doctors, government to go to the periphery, rural health duty. You have to do 5 years, you get PG seat, postgraduate seat. So people are going. Two types of community participation: active and passive. Active cooperative and resource, cooperation and resources, and passive is cooperation only. Advantage of community participation: increase the program acceptance and leadership. So whole the community, whole community is involved. So their program will be successful. Your program only successful when your participants are whole community. Because if the community does not accept it, you cannot have success. Ensure that program meets the local needs. So you have to make the need of the, as for example, there you have made a program here for one disease, that disease is not there. Diarrhea control program in this village, there is no diarrhea. So local need also, you have to give the program. Cost of implementing the program may be reduced by using local resources. So local, this cost of implementation, every program needs finance. So financial cost can be reduced if you use some local resource. Use local and familiar organizations and hence problem solving is inefficient. Local and family, local organizations you have to involve. Commitment to the decision is facilitated, key to the sustainability. And whenever you are implementing a program, it should be sustainable. Then aske dilam, ek bochor pore abar asbo সেরকম। It should be a continuous. So you have to give identification and prioritization of the program, planning together, implementation by community members, evaluation by community members. So implementation by the community people and the evaluation also by community people. So and planning should be done by all the people of the community. I mean, you have to identify and prioritize the problem the key. You have to identify and prioritize. If there is 2 problems, 3 problems, you have to prioritize which one is prior, which is more important. Examples, community participation in India. Community মধ্যে the health village guide, trained guide, ASHA Kurmi nowadays they are in Tripura also. So ASHA Kurmi they are helping in small like pregnant women they are bringing to the PSC and other also they are giving. Selected by the local community and trained locality and associated. These village guides and trained guides they are selected by local community, by Pradhan, Panchayat and local community, they are selecting it and sending for training. So, what are the name of the community-based worker? Village health card in whole country they are there. They are giving health education, maternity child health, family welfare first aid, Mohila Hastram whole country. In Uttar Pradesh, there is community-based worker is there. So, in different states, in our whole country, village health card, Mohila Shastro found. So, what are the works, services provided? They are providing these services. These are the services. Community-based worker also in Uttar Pradesh only assisting ordinary nurse midwife, community mobilization for maternal health services. So, these are some of the name of the community-based worker and country. In some country, in some whole country, some are Andhra Pradesh, some Rajasthan, some Uttar Pradesh, different. So village health and sanitation committee is there. Their roles are multiple roles. Household survey, the preparation of health register for the village, organization of the meetings at the village level, promoting household toilet. Toilet was not there once. Nowadays, government of India is giving toilet in every houses, sanitary toilets. So in Bihar, when you go to train journey, you will see people are sitting on the rail line and defecating. So these are the things you would see TV everywhere. So this has been improved. Nowadays very improved. Earlier it was not there. Rugi Kalyan from the patient welfare society. In every hospital there is Rugi Kalyan. In Nagartala Civil Hospital, in Udaipur, in different district hospitals, Rugi Kalyan Samiti is there, headed by some MLA or some ministers. And so they are also patient welfare, or they are looking after the patient welfare. So intersectoral coordination, I told you, different sectors, national community development, include sustainable participation, intersectoral, all related sectors and aspects, so that there is sustainable and continuous. So the BWD, then different departments, the water supply and other departments. So these are all sector cooperation of the different departments necessary for a program to be successful. As for example, there is waterborne disease in one community, one village. So you are giving medicine. So today you are giving medicine, after 7 days again they are suffering. So what is the source? Your water is the source. So water is how to give? So you give water supply, fresh, well sanitized water, safe water supply. That is this urban water supply, rural water supply department, PW department. So yeah, PWA for district coordination, proper coordination of policies and programs, formation of joint coordination committee for at least level. So whenever there should be a committee, committee, the members should be for health sector, PWD sector. So all sectors, on political sector, everybody should be there to for intersectoral coordination for successful program. So they will have meeting, discussion, debate, and sharing of problem faced in implementation. If you cannot implement, so different they will do everything they will do, and joint evaluation and monitoring. Everybody will go to the village. Everybody will go to the part in different parts of their community, and they will evaluate. We have done this one. Why this is not coming? Different mechanism of coordination. List of names of different sectors identify the NGOs and voluntary organizations. So voluntary organization also participating. So only by government sector, many programs are not successful. Voluntary organizations also helping. So create conflicts of interest and equilibrium. So when there are many sectors, everybody have got some interest. So for intersectoral coordination, they have to solve these power struggles. So PWD, as you always say, I am very powerful than a doctor. Doctor will tell I am powerful, or concept will tell he is powerful. So power struggle will be there. So they should not have like that. They should have the mentality that to help the aiding people, to help the to make successful a program. Cultural changes may occur within the organization. So coordination may turn out to be more expensive in terms of the time, money, and manpower. So if these hurdles are there, there will be more time wasting and manpower wasting and time. So irrespective of things, the principle outlined by WHO, if the health for all is there, intersectoral coordination is very important. Anganwadi worker is also working ICDS project to give ICDS Anganwadi giving nutrition to the Balwadi center. So intersectoral you convergence with Indian system Ayush, coordination with rural health practitioners, they work. We should have many people in the village area goes to Quack. So Quack are also being trained and also involved. They have got major role also in wherever you go to PSC or dispensary, when I was in also dispensary, I have seen in my hospital in 30, 40 years back, in my hospital patient is happening as his home. Patient is coming less than rural practice. Quack is getting more patient than allopathy doctor. 40 years back. Nowadays it is reduced. So in Bihar you see, so in many places, Quack and village people, the Pradhan, I give their faith in, if you go to village, you will see people have got more faith on Ayurvedic treatment and Ayush treatment. So you involve them also, motivate them also, and also village health guard and the panchayat people involve everybody to make this successful. I am a doctor, so I cannot mix with panchayat pradhan. It is not like that. So you go down, you lessen your ego to make your program successful. If we become more egoistic, we cannot become. हम बहुत पढ़ा है MBBS पास किया है कुछ नहीं किया है भैया कुछ नहीं किया so MBBS पास करने के बाद if it is not given service of the people if I pass MBBS MS double MS also if my knowledge is not for common people more the service of the people for implementation of the national programs then help hopeless my degree is in vain. So you have to come down and help the people. So appropriate technology. Technology is that it's scientifically sound and adaptable. What is technology? It should be acceptable, maintained by the people, and scientifically sound and adaptable. This should be technology. Designed to meet the specific health needs, criteria for choosing which needs should be addressed include magnitude of the population affected and morbidity and mortality caused by the health condition. So, mortality and morbidity and magnitude of the population affected by disease. this technology should be based, this technology should be like that. It should meet the demand of magnitude of the population affected. Big magnitude of population and their mortality and morbidity should be lessened by that, and that should be also affordable, accessible, and sustainable. Affordable. So, if a person, if this, you have given a technology, that technology, everything is good, but that is not affordable by the people of this area because of poverty, or accessible because of distance, long distance. So, and it is not sustainable. You cannot give continuously. So, it should be sustainable. It would be accessible for all the sectors of people, local and also a big distance. So, accessible by communication. If it is accessible means, inaccessible means it may be due to communication difficulty. So, it should be accessible to it and it should be affordable. It should be affordable by a rich person, it should be middle class person and the lower sector. If it is poverty, make it free or give it reduced rate, as for example we are doing nowadays. So, national insurance program is there, so government making it free by insurance program also. It should be scientifically valid, adopted by local needs to local needs, acceptable to the users and recipients. So, it should be acceptable by the user as well as recipient, both sides. You give it, tomorrow technology it should be acceptable by you, myself, I use it, it will be simple, and recipient also should be acceptable, maintainable with local resources. So, it should be maintainable by the technology ছিল না একটা জিনিস নষ্ট হয়ে গেল সেটার জন্য দিল্লি থেকে লোক আসবে 15 দিন বন্ধ তাহলে তো it will not be sustainable. Knowledge and skilled user, clear practice guidelines and policies, effective financing and distribution to make them available. Finance is very important for every technology and also every program to be successful. Community efforts to bring clients in contact with the health services in timely way. So, community effort, community থেকে সবাইকে থাকতে হবে যে না আমরা সমাজ তোর কমিউনিটি দুইজনকে বাদ দিবি যে না তোরা দুজন লোকগুলোকে নিয়ে আসবি. They should come in time and contact with all the people who are involved. Only have impact if we incorporated into a comprehensive health delivery system, defining the attributes and characteristics of the appropriate health technology needs to take place early. So, examples of appropriate technology. কি example? আমরা একটা tape রাখি, color tape, the measuring tape, use of ORS. ORS for diarrheal diseases, very common diseases in rural areas because of lack of safe water supply or health sanitation, হাত না ধুয়ে খেলাম, washing without washing hands, we are taking food, নোংরা থাকলে খাবে, ডার্টি খাবার খেলে খাবে. So, tender coconut for oral disease, মানে ওই যে ডাব জিনিস, ডাব খাওয়ার জন্য, oral dietitian জন্য, অথবা নুন জল দিয়ে মিশিয়ে খাওয়া, ও ওয়ারেস, growth chart maintenance under 5 children, growth chart maintain করতে হবে, কতটুকু কোন বয়সে কতটুকু হাইট হবে, কতটুকু ওয়েট হবে, এর চার্ট, এগুলো হচ্ছে appropriate technology. So, these are the জনস্বাস্থ্য সংযোগ, সহযোগ from CMC value range, low cost techniques, detection of urinary infection, cost is less than 2 tests, anemia less than 1 rupees. So, less costly. If the cost is less, more people will be benefited, more people will be attracted. যদি তোর পেশাব পরীক্ষা করতে, ইউরিন টেস্ট করতে, if takes 40-50 rupees, very less people will come. And anemia detection, or hemoglobin detection, so it will take less than 1 rupees. But here you take it will take 50 rupees. So less people will go here to write up. So you take blood from the finger and take the hemoglobin. Information technology advances have been proven ultimately enhancing service health management governance. And telemedicine system is also there nowadays. Here telemedicine system, GB hospital also, you can take advanced you can send you information from rural area like PSC, sub-divisional hospital, one except that they are sending to our telemedicine, we are giving opinion, and the doctors there, where these facilities are not there, specialist facilities is not available, they are giving advice. I can advise from here to a remote village in Gandasara. The doctor of Gandasara will load it in WhatsApp or so you can give advice. Evolution of primary health care in India. One of the first countries to recognize the merits conceptualized in 1946 Health Survey and Development Committee report. And so these are some historical part that is important when you go through in PSM basic health service 1965. So a committee, this Kartar Singh committee. So different. So we have got this evolution how it occurred. So PSC and science over. So these are the 80% of health needs can be met by primary health care. Primary health care, we can meet up 80% health care of the primary. Some cases, then 20% case we have to refer to a higher center. So we have eradicated polymyelitis, elimination of measles, many things, many diseases which were earlier, the smallpox was there, polymyelitis was there. So we have eradicated by our successful program implementation. So maternal mortality rate, you see India, USA, Japan. India is 97 per lakh live birth. Italy is 5. USA 22.3, Japan is 4. So maternal mortality is common. Life expectancy in India is 67.7, Japan is 84.4. So people are living longer in Japan, USA. You see, Bangladesh also is better than us. As per record, I do not know. As per record, Bangladesh is also better. Italy is 2. So India life is less. Maternal mortality is also high. Infant mortality rate in India is 26 per 1,000 live birth. USA 5.6, Italy 2.1, Japan is 2.1. So India is still high. So we have to reduce the infant mortality rate. Yes, WPC is now more than ever. 30 years after Almata. So I told you Almata declaration, whatever is taken in Kazakhstan. So after that, in 30 years what development we have seen. PSC is more than ever. Means we have got improved. Not only PSC, we have got rural hospital and everything facility. PSC also we have got mass facility. X-ray is there nowadays. In our time there was X-ray was not there. 40 years back there was not there. So X-ray facility, specialist facility also available in PSC. Even in dispensary also nowadays doctors are being posted. So there is the communication. One time there was no communication 40 years back, 30 years back when we entered in our service. But it is now very much improved. So all the oil communication improved, education improved, primary education improved, economy improves, healthcare facility also will improve. So ultimately everything depends on this. So fundamental changes have occurred affecting health service delivery. Changes have further increased the critical importance of primary health care and central role in sustainable development. It should aim to, when your health is wealth, if you are healthy nation, all the people are healthy, you development will be very much. Sustainable development will come. সারাক্ষণ যদি রোগ নিয়ে চিন্তা করতে হয়, রোগ নিয়ে ব্যস্ত থাকতে হয়, তাহলে গ্রোথ রেট উঠবে, তুমি কাজ করতে পারবে না, তোমার ইকোনমি ডেভেলপমেন্ট না, ফ্যামিলি ডেভেলপমেন্ট না, সুতরাং তোমাকে হেলদি হতে হবে। ফর হেলদি এনভায়রনমেন্ট ইউ হ্যাভ টু go healthy habits, you have to grow healthy habits, and you have some health knowledge, health education also, health knowledge, primary health knowledge, and you must be conscious about it. So these are the conclusion we have achieved a little many things in 30 years. Our country had already long way we have gone. 40 years back what we have seen, for 30 years back what we have seen, we have developed. Thank you very much for patient sharing. These are the reference. Thank you.